Good evening and welcome to the COVID-19 update on Channels Television. I am Kairo Kikyolu. Here are some of the highlights. Well, after days of anticipation, worship centers in Ogun State reopened to worshippers as Governor Dapo Abiodun eases the weekend lockdown. Well, the fight against COVID-19 in Lagos gets a major boost with the just commissioned Armored Shield Medical Center and Zain Lab PCR laboratory. New Zealand extends COVID-19 restrictions by 12 more days after a cluster of infections was discovered in its biggest city. Thank you for joining us on the program. 24 weeks ago, life as we had known it changed with news that Nigeria recorded its index case of the novel coronavirus, that's COVID-19. Well, it's been an eventful journey from February the 27th till this moment, and clearly it is far from over. But we can try to stay ahead of this deadly virus with one simple yet vital weapon, and that's our face mask, which protects you, yourself, and people around you. Well, that's the message from the Nigeria Center for Disease Control, the NCDC. Well, the agency is asking Nigerians to go the extra step by taking responsibility to slow the spread of COVID-19. In the meantime, Nigeria's latest COVID-19 figures show the virus is not abating just yet. 373 new cases across 19 states, and the FCT means we have now crossed the 48,000 mark, with 34,309 discharges and 966 deaths. A breakdown of the 373 new cases show Lagos with 69, Osun 41, Kaduna and Oyo 40, FCT 35, Plateau 22, Rivers 19, Kano and Ondo 17, Ogun 15, Abia 14, Gombe 12, Imo 9, Enugu 7, Kwara 6, Delta 5, Niger 2, Borno, Bauchi, and Nasarawa with 1 each. Worship centers in Ogun State come alive with activities again as Muslim faithful attend Friday Jumat prayers after months of a ban on religious activities. Worshippers were seen washing their hands, wearing face masks just before having their temperatures checked at the entrance. Governor Dapo Abiodun had earlier asked residents to continue to adhere strictly to the safety protocols put in place to flatten the curve of the coronavirus pandemic. In his words, I am delighted to note that reports reaching us indicate varying but encouraging level of preparedness by worship centers. Therefore, today, Friday, 14th August, is hereby confirmed for the commencement of operations of the worship centers subject to the guidelines. The Ogun State government has also eased the weekend lockdown, but gatherings of more than 20 people are still prohibited.
Worshippers are expected to put on their nose masks, and definitely they must have ensured they have washed their hands and with the use of hand sanitizers. They must also avoid hugging or handshaking, because handshaking is part of the practice of the prophet, that when you finish prayer, even Prophet comments of that, you exchange greetings, salam, salam, and the number is to exchange to shake hands, even in the English-speaking countries. But we have been told that we should avoid this too, in order to avoid contacting the COVID-19 pandemic.
Let's head over to Niger State, where over 1,000 privately owned junior secondary schools are to reopen on August the 17th for exit classes. According to the state government, 202 public junior secondary schools will also reopen a week after the private schools have reopened. This is coming barely a week after over 52,000 senior secondary school students in the state returned to schools in preparation for their final examinations. At a one-day sensitization workshop for administrators of junior secondary schools from both public and private schools, the state government says the gradual reopening is to ensure safety of students and teachers. Our correspondent Emperor Simon reports.
More schools are reopening in Niger State, this time around junior secondary schools. The state government has organized a sensitization workshop for principals of junior secondary schools cutting across private and public schools.
My dear principals, let me remind you that the task of safely reopening our schools is a serious one. It requires every stakeholder to be involved in the process. For this reason, we are creating the enabling environment for parents, for PTA, SBMCs, communities, traditional and religious leaders, civil society, CBOs, and voluntary organizations to be part of the process. Please do not lock out any stakeholder that is willing and able to contribute meaningfully to the reopening our schools.
At least more than 200 public junior secondary schools are reopening, with over 1,000 private schools. The state government says that the reopening is done in batches to ensure safety of the students and teachers.
Part of your school hygiene committee or health committee, you need to have one person that is assigned the responsibility of ensuring that everybody in the school, every minute of the day, has his face mask on.
Even if the person is an asthmatic, you should please use face mask. Go to the hospital and get treatment once there is a crisis. Don't say because there is attack, then I will not use face mask. No, use face mask and quickly evacuate the person to the hospital.
Niger State currently has a total of 228 confirmed positive cases of COVID-19, with 11 dead so far recorded. From Mina, Empress Simon for COVID-19 update.
Well, as part of efforts to complement government's efforts at containing coronavirus in Lagos and by extension Nigeria, Reddington Hospital Group has commissioned the Armored Shield Medical Center and Zainlab PCR Laboratory to take care of all COVID-19 related cases. At the event in Lagos, the State Commissioner for Health, Professor Akin Abayomi, describes the Armored Shield Medical Center as a great example of partnership between the government and private sector, adding that the facilities have gone through rigorous screening processes.
This gathering is necessitated by the common goal to fight COVID-19. Members of the Reddington Hospital Group and officials of the Lagos State Ministry of Health are here to see the birth of Zainlab PCR Laboratory and Armored Shield Medical Center, both facilities under the Reddington Hospital Group.
Based on a needs assessment survey among our corporate clients, the management of the Reddington Hospital Group designed and proposed the Armored Shield Medical Center as a medical program to provide an end-to-end seamless delivery of care against the COVID-19 pandemic for our corporate clients, their employees, families, including children and pregnant employees.
Reddington Hospital established the Armored Shield facilities in different locations in Lagos, away from all our facilities and branches, to give comfort to all our patients that they can now safely access care in these facilities without the fear of COVID.
It's not a day for long speeches as a special guest of honor, who is the Lagos State Commissioner for Health, Professor Akin Abayomi, launches the Zainlab PCR Laboratory and Armored Shield Medical Center for COVID-19 testing and treatment.
This remains the command center.
This place keys into our strategy very nicely because there are many segments of society that still would rather not go to a public health facility. Now, we don't want to stigmatize that group of our society, so it's important for us that we team up with the private sector to provide an environment that some Lagosians would prefer to go to. It's taken 2 months to get this place ready. It's 100% accredited. Every test that's done here, we're really confident about their results, and we keep coming back to check. So it's not just a one-off thing.
The primary thing that makes Armored Shield different is that as a healthcare group, we not only do treatment, but we also test for the virus. So essentially we have end-to-end treatment plan.
The new medical center, built in phases, offers PCR testing for COVID-19, 50-bed private isolation wards, computed tomography or CT scan, high dependency and level 3 intensive care units with state-of-the-art equipment and a multidisciplinary panel of specialists.
We have 2 high dependency rooms as well as 2 ICU units. So for the ICU unit, which is a level 3, we have things like the ventilators, of course, your BiPAP, your BiPAP. You also have your gas analysis machine. So one of the things we have, which is a unique feature from all other isolation centers, is the HEPA filters that we have. Now this is just the exchange of air. This way, the people who are taking care of the sick would actually not get sick too.
We have a team of doctors that have been trained in critical care response. We have also nurses that are trained in critical care. We've got midwives in our group because we have a theater here and we have a delivery suite. We have peri-op nurses, we've got surgeons, we've got pediatricians in case we have a woman that delivers and the baby needs intensive care. And we have a machine here that is the CRRT machine. What it means is continuous renal replacement therapy. So when patients have such problems, we have a nephrologist on board to take care of them. Knowing what COVID is, we place the highest premium on infection prevention control.
The Armored Shield Medical Center also has a COVID-19 command center with 24 hours telemedicine and emergency ambulance response. Yomi Otaigbe, Channels Television News.
Well, joining us this evening to discuss COVID-19 protocols and adherence is a psychotherapist, Tulsi Imagine, is in our Lagos studio. Good evening, thank you for joining us.
Yeah, it's my pleasure to be here with you.
It's great to have you. I recall yesterday the PTF touched on the role of young people, how they've helped in this fight against COVID-19, and also called on other young people to join in this fight, essentially saying, wear your face masks, ensure physical distancing and, adhere to other safety protocols. But you and I know young people think differently, right? Yeah, so how can we tailor that message to suit, the thinking process of young people?
Okay, I think first and foremost is very important that the government propagate this news more often. Mm-hmm. If you put it on TV, how often do we have electricity? How often do we have power? Radio, now social media. More people are on social media. More people are watching the reality shows we have now. So I think the more we propagate the message, the better. There's a saying that faith comes by hearing and hearing. For how we process it, we take in information through our eye gates and ear gates. Mm-hmm. So when we hear and see things, often we tend to believe them. Mm-hmm. The only challenge is that the average Nigerian doesn't trust the government, and the average Nigerian thinks that the government doesn't have his best interest at heart. Mm-hmm. And so I tell people that the greater pandemic here is not COVID-19, it's hunger. And the death rate of COVID-19 is about less than 3%. But what's the death rate of hunger? If you don't eat, of course, you're going to die.
It's so hard to put a figure to that, because I know that conversation, had been ongoing. But, schools have reopened now, although safely. That's what it's called, safe reopening of schools. It's a gradual process for exit classes. And they're meant to write exams in the coming week. But, these children have been at home for a while. I mean, they've not had the opportunity to play with friends, the usual activities they do. Do you think we sometimes neglect what these students are going through, maybe?
Yeah, of course, because naturally we are social animals. We love to mingle. No one can live in isolation. You will die. Everything we do, we wear clothes because of other people. Otherwise, if you weren't taking into cognizance the fact that other people are, on this earth, you would walk naked. So we basically do everything, for relevance, to socialize and all that. And these kids are innocent. They still have a clean slate. Their mind is not like a clean slate. So they want to mingle with their friends. It's the natural process of childhood. And oftentimes when you take away their childhood from them, it affects them over time. It happened to Michael Jackson. Michael Jackson got to the spotlight at the age of 5. Mm. He didn't have time for friends and all that, and it affected him later on in life. So yes, I think we need to take into cognizance the fact that, they need to mingle, but this is a pandemic here.
And we need to adhere to those protocols.
Yeah, this is life.
Yeah, you know, if I can just put this in before we round off, they're going to write exams, and there's been this debate: how hard, how difficult should that examination be? I mean, they're just recovering. So, are you advocating maybe for, you know, stepping down the difficulty level of the examinations, maybe just to take it easy on the students, or still give them the normal dose?
Well, in my opinion, I don't think that's the ultimate determinant of a man's intelligence is an examination. I do know there are a lot of people who do not do well in the classroom, but later on in life, they do so well. So whether they, you know, reduce the cutoff marks or they extend the dates, eventually a child who will succeed. It's fine as a government to maybe lower the scores or find means to ensure that it's better for them, because of course most of them have not been so involved in academics and all that. It's natural. So that can be, I think the government can put that in place. But ultimately, I think intelligence is beyond the classroom or, you know, a test.
You know, that's a great place to anchor. Tulsi Imagine, a psychotherapist. Thank you so much for sharing your thoughts with us.
My pleasure.
Well, we'll take a break now on the program, and when we return, New Zealand Prime Minister is going hard on COVID-19 and she's had to make some tough choices. More on that when we return. Please stay with us. You're welcome back. The National Orientation Agency has launched a motorized awareness campaign on the coronavirus in Nasarawa State. The State Director, Priscilla Gondolo, says the move is necessary to keep the people alert on the reality of the pandemic, especially now that schools have reopened for exit classes.
Ladies and gentlemen, you will also agree with me that government at all levels has taken the most difficult part to opening schools for exiting classes. We all know that it will involve the movement of millions of vulnerable young people across the country. It is in this regard, coupled with the nonchalant attitude of the general public on the pandemic, that the National Orientation Agency, Nasarawa State, is organizing this mega motorized awareness sensitization campaign on COVID-19 to alert the masses on the existence still of the pandemic.
So let's explore some more awareness, and Mrs. Afsa Agbabiaka joins us this evening. She's a pharmacist, American Council on Exercise Certified Health and Fitness Coach, and a fellow of the Postgraduate College of Pharmacists. Thank you for joining us this evening.
Thank you, Kari, for having me.
You know, I'm interested in that health and fitness cap you wear. COVID-19 has changed life as we know it. A lot of people work from home now, which means physical activity has reduced drastically. I'm going to get to diet in a moment, but let's begin with physical activity. There is a danger there, and there's also an opportunity, right?
Yes. Like you said, COVID-19 has disrupted our normal routine. You know, what we are used to doing before now, we're no longer doing it. On a good day, we'd have, you know, we're waking up, we're going to walk, we go to the malls, some people go to the gym and all of that. So now we're locked down and, you know, a lot of people are working from home. They are seated by their TV, addicted to their phone, you know, they're bored, they are eating, you know, getting addicted to junk foods and all of that. So, but, you know, not going to the gym or not moving around doesn't mean that you can't have some level of physical activity. You know, you can move around the house, you can stretch, you can have, even walking around the house, you can do that. You can jump ropes, you know. And of course, not moving around, having a sedentary lifestyle could also predispose one to, you know, deep vein thrombosis, having, you know, that's deep vein thrombosis, having blood clots and all of that. So when you move around, you have some level of physical activity, you know, instead of telling your children to pick maybe the remote control for you, get up, pick it by yourself. Then, of course, people working from home. You know, I have a lot of people complaining that now there is no difference between, you know, when you go to work, you have a 9 to 5. When you get home, you're not doing anything again until you get back to work the following day. But now they don't have like a difference. You know, you are home, you have access to your mails, you can just respond to your, respond to your boss and all of that. So people should have, you know,
a routine.
A routine. When it's time to stop the work, please do. Have some rest, you know. Have your regular sleep pattern mustn't change because you're now at home. So all of this helps to build the immunity and makes you strong and prevent you from even contracting the COVID-19.
I know diet is also a big deal in ensuring that we stay healthy, and apparently our diet has been affected. For a lot of people, I mean, during the lockdown and this eased phase of lockdown, diet has become quite tricky, really. So is there a way out of that also?
Yes, definitely. You know, people think that some particular meals are what they should, you know, take and all of that. But there are different ways that we can take our meals. You know, it's even very good for us nowadays to have lots of fruits and vegetables. You can have your fruits blend into smoothies. You can juice them, you know, a lot of things you can do with them. And you can even include vegetables in your meals. You know, vegetables like the common ugu that we have around, they are even good because they have lots of vitamins and minerals, dark living vegetables, you know, like broccoli as well, like even red bell pepper is very good for us. Lots of fruits, pawpaw is available right now. We can, you know, eat pawpaw, take citrus fruits, lots of fruits and vegetables that we are blessed with.
You know, let me see if I can put you on the spot here. So I know a lot of people are planning for dinner tonight. So what should that plate look like, really, to eat healthy?
Okay, if you're eating healthy, your plate should have, you know, a quarter of fiber-containing meals, must have a quarter of fruits, quarter of vegetables, then you must have water. A lot of people don't drink water. You know, we just take sugary drinks. It's very, very good to have water. It keeps you hydrated, and even the body needs water. And sometimes when we are hungry, we just think that, I mean, when we are thirsty, you know, we think we are hungry. It might just be that you've not been taking water, you've not taken water the whole day. So you just need to take water. You know, we should take dairy in our meals. We should take protein. You know, when you're taking your rice, have vegetables in it. You must have egg, have beans.
My place is full already.
Yeah.
Well, I'd like to thank you so much, Mrs. Hafsa.
You're welcome,
Arabiaka, pharmacist. Thank you for sharing your thoughts with us this evening. Well, countries around the world are experiencing a resurgence of COVID-19 cases. New Zealand is in that situation right now. And here's more on this and other development on our COVID-19 Global Update.
Travellers are rushing to get back to the UK after authorities announced that all arrivals from France and the Netherlands will be subject to a 14-day quarantine starting on Saturday. France says the UK decision will lead to reciprocal measures. Elsewhere in Europe, all Spanish regions have agreed to order the closure of nightclubs and to ban smoking in outdoor areas when keeping a safe distance is impossible. In New Zealand, authorities have announced a 12-day extension of the country's COVID-19 restrictions.
In keeping with our precautionary approach and New Zealand's philosophy of going hard and going early, today Cabinet has agreed to maintain our current settings for an additional 12 days, bringing us to a full 2 weeks in total.
The action follows the discovery on Tuesday of the country's first COVID-19 infections in 102 days in a family in Auckland. Since then, officials have identified a total of 29 cases, all linked to the same cluster.
Not a flinch at all. How is that?
Yeah, not bad.
Okay.
The European Union has reached a deal with a British pharmaceutical firm for the purchase of at least 300 million doses of its potential COVID-19 vaccine. The EU's executive arm, which is negotiating on behalf of the 27 EU states, says the deal also includes an option to purchase 100 million more doses should the vaccine prove safe and effective. And the Africa Centers for Disease Control and Prevention says 7 African countries will begin administering coronavirus antibody tests next week as part of efforts to understand how widespread the infection is on the continent.
Well, take a look at our website, channelstv.com. It has the latest updates on the pandemic, and all you need to do is log on and access news in various sections like this one. COVID-19, Ogun lifts weekend lockdown, Oke's reopening of worship centers, and so much more, all at your fingertips. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikiolu. Do stay healthy.